So with exogenously administered drugs, um, or exogenous biotransformation, we've kind of subdivided some of these different chemical reactions into phase one and phase two. And I'm not going to make you memorize which phases are. I just want you to kind of understand where these are coming from. There won't be an exam that says list some of the phase one reactions and versus list some of the phase two reactions. You don't need to know that, but I think you need to understand the concept of where these drugs are coming from. So here's a couple different scenarios in terms of a few drugs. Here's the absorption phase. Okay, obviously we need the LADME acronym here. Here's metabolism or biotransformation, and then elimination. And so for this particular drug, this drug has a two-phase elimination. So phase one is the first chemical modification, and phase two is a conjugation chemical modification, and because of these two reactions, we can see elimination. Here is a drug that has kind of a two-way metabolism. So there's, think of this as metabolite A and the inactive metabolite B. Okay, both of which would bind to something. The inactive one would probably, may or may not bind to a specific protein or receptor, but it's inactive, so it doesn't really do anything. Most likely, this thing will just be chemically conjugated through a second step and then eliminated. This metabolite obviously would have much more biological activity. Think of this one as being bound to a receptor, and at some point, the binding would disrupt. The drug receptor interaction would dissociate, and then that leftover metabolite would need to be conjugated again to be eliminated. Okay, so these are kind of your classic drugs that requires some type of biotransformation. This would be the exception. This would be a drug kind of like penicillin. So penicillin goes in, there's really no metabolism, and then based on blood flow in the kidney, penicillin comes out. Here's an example of a drug that is administered lipophilic and doesn't really have major enzyme-dependent modifications. But at some point, the drug either degrades or passes through enough membranes so that at some point it becomes hydrophilic, which facilitates its elimination as well. Some of these drugs that are lipophilic are, maybe kind of large molecule, bulky type molecules, and parts of them get broken off, and then the parts that get broken off are all of a sudden become hydrophilic. And so these are all the different kind of possible reactions that can occur. Let's look at some phase one reactions. So this is a nice example, of a phase one reaction. Here's your ring structure, okay, with one substituted R group undergoing a simple chemical reaction where the R group is still intact, but now you've got a hydroxyl group. This R group can also be modified specifically, but here you see kind of an opening of the benzene molecule, a breaking of this double bond, and insertion of oxygen. Okay, what does this mean? So most of the phase one reactions are either redox reactions, reduction, oxidation, or hydrolysis reactions, which are shown here. And then in terms of outcome, what we're doing is we're seeing an increase in water solubility, and so these type of reactions actually facilitate faster excretion, and in many instances they can alter biological activity. And it's hard to predict if it's going to be up or down. It depends on the chemical. All right. Phase two reactions are a little bit more involved: glucuronidation, sulfation, conjugation with a glycine molecule, acetylation, methylation. And so you can see a little bit more involved chemistry here. In terms of organic chemistry, you can see organic acids or methyl groups. There's a sulfonic acid reaction that's occurring here in this molecule. And in terms of outcomes, again, we see an increase in water solubility, which facilitates more rapid excretion, especially for the first four reactions. But the last two, acetylation and methylation, acetylation and methylation will reduce excretion. Okay, and so whenever you see a reduction in excretion, most often biological activity is usually reduced or hampered. Okay, so what does this mean for, clinically? Well, here's a whole bunch of drugs that kind of undergo the descriptor here in bold. So here's one process where you see an active drug being biotransformed into an inactive metabolite. Okay, and so warfarin, morphine, acetaminophen, isoniazid. Here's an example where you see an active drug getting converted to sometimes more active metabolites. And so, diazepam may have an activity output of, say, 20 arbitrary units. Nordiazepam would have an activity output of maybe 70 arbitrary units. The same can be said, codeine gets converted into morphine, and morphine is more biologically active. All right. Here's a good example where you see a prodrug, which is inactive, gets converted to an active metabolite, and there's tons of instances where that occurs. Tamoxifen, lovastatin, enalapril, and some of these other ones that are listed here. These are all on the left-hand side of the arrow. These are all biologically active. They don't do anything in the body until they become activated into this particular chemical, which is listed here. Many of you may be wondering, why not just administer this chemical? Oftentimes, the chemical on the right is less stable, and so that's why this version of the chemical must be administered. In some cases, you can see a non-toxic drug or a non-toxic chemical be converted to a toxic metabolite. And so acetaminophen, in order for it to be biologically active, has to go through this step first, but in certain pathological scenarios, and especially in scenarios of overdose, normal levels of acetaminophen can quickly turn into toxic levels, especially if there's some type of unique biological activity. Cyclophosphamide, the reason that cyclophosphamide is toxic to the kidneys is because this particular metabolite accumulates within the urinary bladder. Okay. Methanol is really toxic when it gets converted into formic acid. That's the thing that makes you go blind. And of course, doxorubicin, the chemotherapy, has this nasty toxic metabolite, doxorubicinol, which has a lot of systemic problems as well, which we'll talk about in the heme block in more detail. So these are kind of the main four clinical effects or physiological effects of biotransformation. You don't need to know all of these different conversion pathways or even which drugs undergo are part of which list, but I think you need to understand these concepts that something that's active can go to something that's inactive, something that's active can go into something that's possibly more active, something that's a prodrug can be activated, and something that's non-toxic can be toxic. These are the main kind of points. And I think if you remember that, it'll help you in terms of the pharmacology too, because as you read up some of these drugs, and it'll say, well, in overdose situations, you can see this. Patients that have altered metabolism or a polymorphism, which we're going to talk about, may have this, and so it's really kind of important to understand conceptually. Here's a good example. Many of you would consider that phase 1 reactions must occur before phase 2 in order. It's just a grouping. So here's a good example of isoniazid, also called NIH. The first reaction that it undergoes is a phase 2 type of reaction. The second one is a phase 1 type of reaction. So it goes from acetylation to hydrolysis, and the chemistry is shown here. Okay, and then it's this metabolite, okay, that's hepatotoxic. All right. And so what you have to worry about is, in terms of the patient population, is what does the hydrolysis reaction look like in a typical patient population, and how much of this dose is going to become this particular molecule, which is hepatotoxic. And so when we talk about LD50 versus well, I guess not LD, but ED50 versus TD50, what we're really looking at is the ratio of these metabolites to these metabolites. And of course, this kind of feeds into that therapeutic index pathway. All right. Let's take a break here and let's kind of go over some of these CYP enzymes in relation to some of these chemical reactions.